Now, earlier this morning, the House Ways and Means Committee had a hearing on Medicare for All. That is the single-payer health care put forward by Bernie Sanders, backed by Pramila Jayapal. A lot of progressives are in favor, which would basically create a government insurance program that would cover every single man, woman, and child in the country and do it for a lot cheaper. So, look, that's a good plan. I'm in favor of that plan. But apparently, not only Republicans, but Democrats as well are not in favor, and this would include Committee Chairman Representative Richard Neal, who before the hearing began, reportedly informed the panel's Democrats behind closed doors that he does not want the phrase Medicare for All to be mentioned at all during the session. So here we have a hearing that's supposed to be about Medicare for All, where you can't mention the words Medicare for All. Isn't that a little strange? I don't want you guys to mention that, but wait, that's what we're here to talk about. Yes, but you can't talk about it. Then what are you supposed to talk about? Well, let me go to the Intercept reporting here. Neal, Massachusetts Democrat, has been in office since 1989, told the Democrats in the panel that he didn't want the phrase Medicare for All to be used. Instead, he said the hearing should focus on all the different ways to achieve what he calls universal health care, or universal health coverage, which he said was a better term to deploy. Okay, look, if you're talking about terms, this goes back to earlier Intercept reporting where there was a slideshow that was given in private to Democrats, and I believe bundlers and maybe some donors and fundraisers that talked about, hey, we cannot, it's not politically good to use the words Medicare for All. How about we do this instead? But this is not just about language, right? This is policy. Let me give you the quote on how he feels about Medicare for All as a policy. Quote, Medicare for All was wrong on policy and is a political loser. This is according to sources cited present at the meeting that was held last week. I mean, that's pretty clear. Look, Medicare for All is the best way to achieve universal coverage. If that's what you want to do, if you want universal health care coverage, that's the way to do it. That's the most efficient way. That's the best way. It's actually one of the cheapest ways. If you don't want to do it, if you don't agree that's the best, like if you don't like that policy, then you're basically saying, I actually don't want universal health care. I don't want real universal health care. I want fake universal health care. I want maybe a public option, which is a Band-Aid. Or I want to just fix the ACA, which has left 30 million people without health insurance because we can't afford it. And the people that have health insurance have to pay copays and deductibles that they oftentimes cannot afford. So, look, either you're in favor of universal health care, which is Medicare for All, or you're not. I think it's fairly clear that Richard Neal is not in favor of universal health care. It's BS. All right, he continues. I'm starting to get a little angry. Okay. Neal did not deny, by the way, to The Intercept, that he wanted the focus of the hearing to be on the more vague idea of universal health care rather than the specific solutions proposed by Medicare for All advocates. I don't care about details. I don't care about policy. All I care about is making my donors happy. And my donors hate Medicare for All. He said, quote, I think what we're talking about is universal health care and access. Access. Oh, here we go with that access crap. You know what? I have access to a Lamborghini. Doesn't mean I can go and get one. Well, I have access to it. I can't afford it, but I have access. Well, it's the same thing with people's health care. And by the way, not the same thing. Terrible. Like, example, because healthcare is not a consumer good. It's not an iPhone. You can't just opt out of healthcare. No, I mean, I could go and get a heart heart surgery or something, or I could get an iPhone. I'd just rather get an iPhone because if my heart fails, I'll be fine. No, you'll be dead. You die without health care. You die without things like insulin. Healthcare is basically the most important thing that you can have. I guess aside from breathable air, drinkable water, and food, it's a human right. It's a human right. And you shouldn't have to have access to human rights. It's a human right, which means you get it. But he says, quote, "That's the emphasis. So we have not ruled anything out or anything in." You just ruled Medicare for all out. You said, I don't specifically do not want to mention Medicare for all in this hearing at all. So immediately you were lying. You were lying. You were lying. And he said this finally, quote, "And we think that continuing to gather information, I mean, I helped to write the Affordable Care Act. I'm naturally in favor of expanding it." Anything but Medicare for all. Anything but Medicare for all. That's what he's saying. Or really anything that threatens his precious health insurance industry. Now, Richard Neal has gotten tons of money from that very industry. Is it any wonder why he does not want to talk about Medicare for all? Is it any wonder? Is it any wonder? Now, Bonnie Castillo, who's a registered nurse, and also the executive director of the National Nurses United, who has been pushing Medicare for all, follow the nurses because they actually know what's going on. She said, quote, "The existing system reinforced the healthcare industry that is structured to generate profits, not to take care of people. Leaving commercial insurers in charge of our health would continue to fail patients. Exactly why Medicare for all is the only solution that will guarantee healthcare as a human right in the U.S., as in so many other wealthy nations. And, by the way, it will do it more cheaply than our current broken-ass system does." But, of course, with any giant transformational change, you're going to have people who benefit from the status quo. And those people who benefit are going to defend it at all costs. So understand that whoever's doing that, be it a congressman or a presidential candidate, whoever's doing that is not on your side. Hey guys, hopefully you enjoyed that free video. Now I'm going to ask you a favor. Between the demonetization and the YouTube algorithm messing around with view counts, etc., we're having a hard time adjusting to the new YouTube reality, which is where you guys come in. See, we have a Patreon, patreon.com/TYTNation, set up to help us rely on you guys, the viewers, instead of big corporate ads. Look, you know the show. You know how I'm not in favor of big corporations anyway. So help us transition away from relying on the ad model to pay the bills and sign up to be a patron, patreon.com/TYTNation. That goes a long way to help us keep the lights on. And you guys will know that you're supporting independent progressive media.